Understanding diarrhea begins with recognizing its definition and symptoms. Diarrhea is a common condition that affects people of all ages. It's characterized by loose, watery stools and a frequent need to have a bowel movement. This condition can be acute or chronic, depending on its duration and underlying causes. The primary symptom of diarrhea is the passage of loose or watery stools. This can happen several times a day and may be accompanied by a sense of urgency. Some people might experience incontinence, making it difficult to control bowel movements. In addition to loose stools, diarrhea often comes with other symptoms. These can include abdominal cramps, nausea, vomiting, and fever. Diarrhea can be caused by a variety of factors. Infections are a common cause. Viral infections, like norovirus, can lead to sudden diarrhea. Bacterial infections, such as E. coli, are also frequent culprits. Food intolerances can trigger diarrhea. Lactose intolerance occurs when the body cannot digest lactose. Medications, especially antibiotics, can disrupt gut bacteria. Medical conditions like IBS and Crohn's disease play a significant role. Diarrhea can have a significant impact on health, especially if it is severe or prolonged. One of the most immediate concerns is dehydration. This occurs when the body loses more fluids than it takes in, which can be dangerous if not addressed promptly. Electrolyte imbalance is another serious consequence of diarrhea. Electrolytes such as sodium, potassium, and chloride are essential for various bodily functions. When these are lost through excessive stool output, it can lead to muscle cramps, weakness, and irregular heartbeats. Diarrhea can also affect nutrient absorption. When food moves too quickly through the digestive tract, there is less time for nutrients to be absorbed. This can lead to deficiencies and malnutrition, particularly in children and the elderly. Prolonged or chronic diarrhea can indicate underlying health issues. Conditions like IBS or IBD require ongoing management and medical supervision. Chronic diarrhea can also be a sign of more serious diseases, such as celiac disease or even certain cancers. Section 4. Diagnosing diarrhea. Doctors diagnose diarrhea by assessing symptoms and medical history. They will ask about the frequency and consistency of bowel movements, as well as any accompanying symptoms like cramps or fever. This helps in identifying the potential cause. A detailed medical history is crucial. Patients will be asked about recent travel, dietary habits, and any medications they are taking. This information can provide clues about whether the diarrhea is due to an infection, food intolerance, or medication side effect. Stool tests are often conducted to diagnose diarrhea. These tests can detect the presence of bacteria, viruses, or parasites in the stool. They can also reveal signs of inflammation or bleeding, which are important in diagnosing conditions like IBD. In some cases, additional tests may be needed. These can include blood tests, imaging studies, or even a colonoscopy. These tests help to rule out other conditions and provide a more comprehensive understanding of the patient's health. Section 5. Treatments and prevention tips. Treating diarrhea involves rehydration, rest, and dietary changes. Rehydration is essential to replace lost fluids and electrolytes. Oral rehydration solutions are commonly used to prevent dehydration. Rest and avoiding irritating foods like dairy, fatty foods, and caffeine are important. A bland diet, like the Brat diet, is recommended. Medications like antidiarrheals and antibiotics may be used. Probiotics can help restore gut bacteria balance. Preventing diarrhea involves good hygiene and safe food practices. Wash hands thoroughly before eating and after using the restroom. Ensure food is cooked properly to prevent foodborne illnesses.